Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, Chief Medical Officer of Good Samaritan Physician Network. Today, I'm joined with Dr. Kristin Mahan, who's one of my colleagues now for 22 years, perhaps.
Yes, I think so.
She is our outgoing president of the medical staff. Let's see, what are your stats? Already as the director of hospice and also director
of Convenient Care Clinic.
Convenient Care Clinic. So she'll be talking with me today, taking the place of Adam Thacker. As usual, we're going to run down our typical statistics, kind of where we have been, where we are going. Around 3,200 cases since the beginning, around 208 that are active, which is down a little bit over the course of the past several weeks or so. And then the statistics that we look at every week most closely, which is the number of positives over the course of the past 7 days of all individuals, which is about 15%, and then of unique individuals, which is around 28%. Those numbers have gone up just a little bit. So from last week when we spoke, things had kind of gone into a little bit of a lull, and then we were expecting that they would potentially go back up after the holidays. And that's what we've seen. And I think in the clinical environment, that's what we've seen as well.
Absolutely.
Basically, the lag period is because of the incubation time of the illness and what we see after the holidays. And we saw this after 4th of July and after Labor Day, and as we've kind of gone through things, usually there's a couple-week lag, and we have seen that go back up. Our county went back into the red as of last week, and those numbers are based on the unique individuals and also the all-positivity rate. That all-positivity rate crept back up. We got down as low as around 12% or so last week, and it's crept back up to a little bit over 15% this week. One of the really highlights, I would say, over the course of the past few weeks has been the success with vaccinations. So I know you and I have both been vaccinated.
That's right. We've both gotten both of our shots and are fully vaccinated now. So that was a good experience. The vaccine clinic is very efficient. Hopefully several of you in the community have been able to take part in that. Currently in Indiana, people 70 and over can be vaccinated, and the way to sign up for that is at ourshot.in.gov, and that should actually give you a couple of options to be vaccinated at a clinic here at Good Samaritan Hospital or a clinic run by the county health department, which is being held at Community United Methodist Church.
Yeah, and that's just really over the course of the past 3 weeks or so. You and I just got our second doses,
right.
21 days in between first and second dose. So we've been through the first 3 weeks of that, and just during that first 3 weeks, we vaccinated over 4,600 people. And of that 4,600, we've now been through about 1,000 that have gotten their second doses. Mm-hmm. And we're considered to be fully vaccinated now once you've gotten those 2 doses. And we anticipate that as we continue to roll that over the next several months or so, and we get a larger and larger percentage of our population protected, especially those, as Dr. Mahan said, that are in the 70 and older crowd, we feel much more comfortable that the severity of the illness will be less and less. When we look at the statistics, the reason that they have stratified age as one of the primary risk factors is because when we look at those who have been most ill and the death rate, it's really been in that crowd that gets 65, 70, and above. When I looked at them today statewide, the statistics are of all the people who have died from COVID, almost 75 to 80% have been those in the 70 and over crowd.
Right.
And so, as Dr. Mahan had mentioned, initially opened up to 80 and above, and then just within a few days, dropped down to 70.
Right. And the next phase will go to 60 and over, so just keep your eyes and ears open because you will hear that, I think, on media and so forth. But currently 70 and over are eligible to register to get vaccinated.
And the website that Dr. Mahan mentioned, the ourshotindiana.gov, you can just Google Ourshot Indiana. Mm-hmm. You can do ourshot.in.gov. And all of the vaccine scheduling is doing that way now. Initially, it was to call our clinic or schedule through the state. Mm-hmm. That has all been consolidated into that website. If you have questions, you can certainly talk with your primary care providers, call our triage line, but that is the primary way to get scheduled. In checking with the schedule this morning, it looked like we were scheduling out to about 2/9, so February the 9th was the next available. So don't be overly frustrated when you can't get in today or tomorrow, but please get your name on the list and get set up for that. Because really, we want to get as many people vaccinated as quickly as we can, as safely as we can, and the efficiency of the 2 clinics we've got set up now has really been, I think, spectacular over the past few weeks.
It really has.
Now, one of the other things that you've been integral in is the administration of the monoclonal antibody. Can you tell us a little bit about that?
Sure. So I became pretty involved in that with my role as medical director of Convenient Care Clinic. And monoclonal antibody is an infusion that we give when someone is identified as having a positive COVID test. Early in the course of their illness is when we administer that infusion. And it's designed to treat people who are at high risk of serious disease. So the degree of your symptoms is not what dictates who's eligible for that infusion. It's actually your risk to develop serious disease or be hospitalized. So, for example, people over age 65, people with lung diseases that require daily controllers, so have a significant lung disease, people with diabetes, for example, folks who are morbidly obese are at high risk of hospitalization and serious disease. So, the bottom line is I would encourage anyone who thinks they may have COVID symptoms to be seen by their primary care provider or at one of our convenient care clinics, which are located on Willow Street, or on Washington Avenue in Williams Brothers, because a provider can assess you, determine if you truly have COVID. If you have symptoms, we have a test that gets us a result within about 15 minutes. And if you are an appropriate candidate for monoclonal antibody infusion, that provider will get that set up for you right away. So that reduces your risk of being hospitalized or requiring ventilatory support. So that's really been a great thing in our community. We've given close to 300 doses of monoclonal antibody and have had only 2 or 3 of those patients require hospitalization. So a significant reduction in hospitalization rates, which has been a really wonderful thing for patients and, quite frankly, also for our staff who are working in the ICU and caring for people.
So that's really been kind of a bridge to getting a larger percentage of the population vaccinated, is during this period of time where we're trying to get our higher risk people vaccinated, the 70 and older crowd, we really want to make sure, as Dr. Mahan mentioned, that during those first few days of illness, if you suspect that you have COVID, even if those symptoms are relatively mild, upper respiratory congestion, cough, loss of taste and smell, fever, those types of things, we want that higher risk population, as she described, to get evaluated, be seen by a provider, get that rapid test, which takes 15 minutes, and then that decision-making process can occur more quickly. Once we've identified those patients that are at the higher risk and have a positive test that are in those first few days of illness, generally we get that bamlanivimab or Regeneron infusion done that day or the next day. The place where we've been doing that is in our clinical decision unit, and generally on any given day, somewhere between probably 5 and 10 of those administrations are being given. And what we have seen is that the turnaround has been very quick. A lot of patients report within about 2 to 3 days of receiving that infusion that their symptoms have resolved or have been minimized, and they feel better and they're turning around very quickly. The key that we found to that, though, clinically, is really trying to get involved in that patient's care as soon as possible. We use the criteria generally of those higher risk populations that are positive and have had symptoms less than 7 days. But really, I would say we would prefer to catch people on day 2,
3, right. The earlier in the course, the better that treatment will work because of the way it works. So monoclonal antibody actually grabs on to that coronavirus and prevents it from entering cells and replicating. So that works really well early in the course of illness, but it doesn't work very well if that ball has rolled on and now you've got lots of replication and your own immune response is making you very ill. So it really is designed and best used in the first few days of illness, but up to 7 days of symptoms, we certainly consider using it. But that's why it's so important to get in and be evaluated relatively early in the course of symptoms.
Certainly. And we encourage anybody, if you have questions about this, please contact your primary care provider. If there's any question as to whether you actually have the illness or your exposure, so forth, again, please get evaluated. In the lower risk populations, we're still giving very similar advice that we did back 9 months ago, which is if you have relatively mild symptoms, you're younger, you don't have a lot of risk factors. For most of those individuals, this continues to be an upper respiratory virus that's cold-like symptoms, and it generally isn't very severe. We would ask those people to isolate themselves, make sure that they're quarantining those around them appropriately, let the disease course run its illness. However, in the population that Dr. Mahan and I are talking about, it's very important to get identified early, get tested early, and then we can get that monoclonal antibody infusion administered. When we look throughout the state, we're one of the hospitals that has administered more of that than any other hospital, and it's because really we bought into that early on to realize that this was going to be something that would help bridge us until we had a larger percentage of the population vaccinated, at which point we'll feel more comfortable that those patients won't be at highest risk. One of the other things that we talk about is being a red county and being burnt orange and light orange and kind of where we are. And unfortunately, as of this morning, we are back in the red, and that has everything to do with that percentage of positive. But those update every day, and we would hope, given the numbers, that we see that little bump and then things run back down. But it's very important for people to realize that this is kind of a typical sick time of year for most of us to deal with. And so normally this would be when we would enter flu season.
Absolutely, and typically maybe even seeing some flu cases in the last couple of months, and we haven't seen that, and I don't think that means we're free of influenza necessarily, but there's a lot of reasons for that. Influenza travels from continent to continent every year, and international travel has been extremely minimal over the last 9 months or 10 months for obvious reasons. And also people are doing more hand washing and masking, which has really reduced spread of, I'm sure, influenza, but also things like colds, quite frankly.
In our pediatric population, we generally see a big spike around the holidays and then post-holidays in terms of viral upper respiratory infections, influenza, gastroenteritis, which is a viral infection of the bowels. And I don't know how it's been in your clinic, but I've seen very minimal of those compared to normal.
Yes, much less than typical.
So we would like to thank all the schools for doing such a good job. One of the things that has been a shining star from the beginning of this is how good our schools have done. And as you would expect, children follow rules very well. They follow it probably better than us adults do. And so the school administrators, the teachers, everybody who's been organizing that has done a fantastic job. And I think as of this past week, everybody is back to in-person learning.
I think so.
We had been through a time where over the holidays, obviously, people got pulled back in, and then there was a little bit of a delay with some virtual learning with some of the schools. But I think as of last week, everyone went back to in-person learning, except for a little delay this morning, unrelated to any viral infections. But we'd like to thank all the schools for doing a great job with that as we continue on. We also generally every week talk a little bit about what the visitation policy has been, and we continue in a restricted visitation policy that's essentially unchanged over the past several weeks. The reasoning for that is because of the percentage stats that we look at and the county being red, and we will continue to look at that on a weekly basis. Any time that you need to be present to help out with a family member who has difficulty caring for themselves, difficulty with their medications, we certainly want patients to come in and be with them in clinic or in the hospital setting to make sure that we're getting the most accurate information and that's being passed on to them. But otherwise, restrictions remain in place, and we continue to look at that on a weekly basis. Any other particular things you want to talk about before we go to the phones?
No, I think we can go to the phones.
All right. Tiffany, what do you got?
There's several questions from one person about the vaccine and quarantining, or getting the vaccine. See, after having COVID and quarantining, or after receiving the infusion and quarantining, should you wait 90 days to get your first vaccination? And why wait 90 days? How is the 90 days determined to be the waiting period?
Sure. Now you have to handle all the pharmacy questions because that's usually Adam's job.
Do you want me to take this
Sure.
one? So you actually don't have to wait 90 days to receive your vaccine after having COVID. So generally, when they've looked at studies of people who have had COVID disease, most individuals have natural antibodies from having infection for 90 days or more. So we feel pretty comfortable saying there's some natural immunity for up to 90 days, and perhaps more in some individuals, that does give you some protection. However, that doesn't mean you have to wait 90 days to get your vaccine. What we would recommend is if you have had COVID and you'd like to get vaccinated, you should be recovered from the illness, okay? So you should be past your 10-day self-isolation period, and your symptoms should be very minimal or resolved to go ahead and get your vaccine. And I will tell you, we've had a few examples of people who got their first dose of vaccine and 2 or 3 days later developed symptoms of COVID and indeed had COVID. that's not from the vaccine. They had been exposed to COVID a week or 10 days prior and developed illness. Obviously, 2 days after you get your shot is not adequate time to develop immunity. Even in those folks, so they got their first vaccine, now they're supposed to get their second vaccine in 21 days. A couple people who've had this COVID in the interim, they still are to go ahead and get their second dose of vaccine at that 21-day mark, so long as they are recovered from COVID infection.
So the same person asked about, after receiving the second vaccine, when are you considered to have immunity? How long is the immunity for?
Well, that two-part question, the first part is we believe usually within a couple weeks or so after receiving your second vaccine that you would be considered fully vaccinated and then protected. And the statistics that we've seen coming out of the studies, anywhere from the 94 to 95% reduction in risk after that second vaccine administration. The big question on everybody's mind, which is being studied now and they will continue to look at over the course of the next year, is how long does that immunity last for? Will there be a booster dose in years to come? Will there be something that changes about the dose in the future? And the answer right now is we don't know. Those studies are being conducted. All the people that are being vaccinated, they will then go back and look at random samplings of those to say, how long did immunity last? And as Dr. Mahan was saying, thankfully, because this has been over such a long period of time, and we've been somewhat protected in the rural area to a later onset, we've been able to look and see what has happened in other locations. And so there have been people that have received immunity, presumably from having the illness early in the course of this, which would have been in March, April, May of last year, that then had the illness again later in the fall. And that's the reason why we believe probably that 90 days is the window that we're looking at. It very well may be much longer than that, and we certainly anticipate that it will be much longer than that with the vaccine. But as we march through the next year or so, those studies are being done to look to see how long that immunity will last. Will there be booster doses? What will happen with this vaccine, the mRNA vaccine, versus the other types of vaccines, and what will happen with those? But that's all still in the works right now.
And someone asked if it is safe for women who are breastfeeding to get the vaccine.
It is safe for women who are breastfeeding, and in fact, ACOG, for example, the American College of OBGYNs, highly recommends receiving the vaccine if you're eligible when breastfeeding. Your immune response, so antibody production in the mother after she receives vaccine, will likely transfer some antibodies passively in breast milk, which will help protect the baby from COVID disease as well. So yes, it absolutely is safe and recommended in breastfeeding.
And someone asked, if their second shot is already scheduled, will there definitely be vaccine available for their scheduled time?
Sure, and this will vary depending upon what area of the nation you are getting your vaccine in. Here, we are reserving the second dose once you've received the first dose. In other places, Florida, for instance, California as well, they are mass administering vaccine with the thought that vaccine production will continue to catch up with the need. But here, we are reserving that second dose to everybody who has received a first dose. And one question that we get frequently is, do I need to hold out for this vaccine versus that vaccine? And the answer is no. You need to get whatever vaccine is available to you the soonest possible. We both received the Pfizer vaccine. Moderna is the vaccine that's being used at United Community Methodist Church. However, it does not matter which vaccine you get, but you need to receive the same second vaccine as what the first vaccine is that you received.
Correct.
Okay, that looks like all the questions for today.
Very good. Well, we thank everybody for joining us this week, and we'll be with you again in 1 week. Thanks, Dr. Mahan, for being with me today.
Thanks for having me.
Filling in with for Adam and fielding all the pharmacy questions I couldn't potentially answer. Thank you all.